Hi everyone, welcome back. In today's video, in this tutorial I am going to show you how you can simply dilute or reconstitute ampicillin injection. So in this video I am going to show you how you can simply prepare ampicillin for injection. So generally we have three forms of ampicillin injection. We have the 250 milligram vial powder to be dissolved with 2.4 ml of sterile water for injection. And we have the 500 milligram powder to be dissolved with 4.7 ml of sterile water for injection. And we have the 1 gram powder to be dissolved with 5 ml of sterile water for injection. So in this video, I will show you a step-by-step method in which you can simply reconstitute or dilute ampicillin for injection so that you can administer safely to the patient. So before you start, make sure that you gather all the supplies that you require for you to perform the procedure. For instance, you may need a 21 gauge needle, you may need a syringe, especially the 5 ml of. You will need a water for injection, so this is sterile water for injection. You will need the white powder of ampicillin. You will need an alcohol swabs, so this is an alcohol swabs for you to clean the opening of the vial. Before we dive into our tutorial, kindly please, if you are a new member to this channel, kindly hit the subscribe button, like and share, and give your comment to this video. And if you have previously subscribed, kindly please stay with us until the end of the video. Give us that comment and leave your comment in the comment section below. So let us start now. So make sure that you clean your working bench before you start the procedure. Then you gather all the supplies that you require for you to perform the procedure. Okay, before we start, let us see now brief overview about the therapeutic classification of ampicillin. Ampicillin is antibiotics which is used to treat a number of conditions. So it is active against gram-negative and gram-positive bacteria. So therapeutic action, it is antibacterial, which is penicillin. We use ampicillin to treat a number of conditions like severe bacterial infections, which include meningitis, pneumonia, septicemia, pyelonephritis, and cutaneous anthrax. What about forms of strength? So we have the 250 milligram vial powder to be dissolved with 2.7 ml of sterile water for injection. And we have the 500 milligram powder to be dissolved with 4.7 ml of sterile water for injection. And we have the 1 gram powder to be dissolved with 5 ml of sterile water for injection. What about the dose? So you can give ampicillin through IM or IV route. And generally, the recommended dose is 50 mg to 100 mg per kg. That is multiplied by the body weight of the patient. So you can administer by giving either 50 mg to 100 mg per kg. That is multiplied by the body weight of the patient. Okay, you can administer through IM route if you want to give in higher doses. But for IV, you can give through IV injection 3 to 5 minutes. You can also administer through infusion over 30 minutes. You can add in normacerin, that is 0.9% of sodium chloride, or you can either add dextrose 5% infusion. Okay, what about the contraindication? So ampicillin is generally safe. It is not contraindicated during pregnancy and breastfeeding. So generally, ampicillin is safe during pregnancy and lactating mother. What about the side effects? So generally it can cause nausea, vomiting, diarrhea, or maybe abdominal pain. So precaution, make sure that do not combine with methotrexate, or do not combine or mix another medicine in the same syringe. Make sure you avoid that. And whenever you are preparing the drug, make sure you avoid in a heated area, or maybe you have to avoid an area where there's a traffic, because there is a flow of an air that can contaminate the drug. I hope you have gotten up to that point. Okay, let us start now. For the 250 milligram powder for injection, you can prepare by adding 2.4 ml of sterile water for injection. So what you do, you get the syringe. So you get the syringe together with the 21 gauge needle. So you get a 21 gauge needle together with the syringe. So you remove the syringe from the manufacturer's packaging, you get the needle, then you attach it into the syringe. Then what you do, you get the sterile water for injection and you open. So this is the plastic vial containing the sterile water for injection. Then what you do, you remove the cap of the needle first. So I am going to show you how you can dilute with the one of 250 milligram vial powder to be dissolved with 2.4 ml of sterile water for injection. So what you do, first you withdraw the water for injection. First you withdraw 2.4 ml of sterile water for injection. So you have to withdraw 2.4 ml of sterile water for injection. Then what you do, you put the cap of the needle to maintain the sterility of the drug. Then what you do, you get the vial containing the white powder of 250 milligram of Ampicillin injection. You open the vial. Then what you do, you get an alcohol swabs. So this is an alcohol swabs. You clean the opening of the vial first. Then when you clean, you get the sterile water for injection. You remove the cap of the needle. Then what you do, you inject it into the vial slowly. Then you have to transfer all the sterile water for injection into the vial. You remove it, then you start shaking it gently like this. So make sure you shake it gently like this. You shake it gently like this until all the solution is completely dissolved. So you have to shake it. Make sure you shake the vial gently so that all the drug can be completely dissolved. When you finish diluting the drug, then what to do, you have to withdraw the drug from the vial. Okay, let me show you. Then what to do, when you finish diluting the drug, then I will show you how you can simply withdraw the drug from the vial. So what you do, first you get the syringe together with the needle. You remove the cap of the needle first. Then what you do, you get the vial containing the drug. Then you have to put first equal amount of vial into the vial. So we have diluted it with 2.4 ml of sterile water for injection. Then what you do, you have to put equal amount of air into the vial. So make sure you add equal amount of air into the vial before you start withdrawing the drug from the vial. Then what you do, you hold the vial in upside down manner horizontally. Then you start withdrawing the drug simply. Make sure you keep the needle in line with the drug to avoid air bubble rushing into the syringe. When you finish, then first make sure you remove the air bubble. So make sure that you remove the air bubbles. Then what you do, you put back the cap of the needle to ensure sterility of the drug or to avoid contamination. Then what you do, once you have reconstituted, you should administer the drug to the patient immediately. So make sure that before you administer, follow the guidelines of drug administration. Right patient, right drug, right dose, right route, right time, right reason, and the right documentation. What about the 500 milligram mg powder? So in the 500 milligram powder, you can dissolve with 4.7 ml of sterile water for injection. Okay, let us perform now. You get the syringe together with 21 gauge needle. So you get a 21 gauge needle. You get the syringe. You remove it from the manufacturer's packaging, and you get the 21 gauge needle. Then you attach the needle into the syringe. Then what you do, this is the 500 milligram powder to be dissolved with 4.7 ml of sterile water for injection. So you get the sterile water for injection. you withdraw 4.7 millis. Okay, make sure withdraw only 4.7 millis of sterile water for injection when you are preparing the 500 milligram powder for injection. So you only withdraw 4.7 millis of sterile water for injection. 4.7 millis. I hope you can see. Then what you do, you put back the cap of the needle. Then you get the vial of 500 milligram. So you take off, you open the opening of the vial. Then what you do, you get an alcohol swabs. You clean the opening of the vial first with an alcohol swabs. Then you get the sterile water for injection. That is 4.7 millis of sterile water for injection to be dissolved with the 500 milligram powder for injection. So you inject the needle into the vial. Then you transfer all the sterile water for injection into the vial. Then you remove the needle from the vial. Then you start shaking it gently like this until the drug is completely dissolved. Make sure you shake it gently until all the solution is completely dissolved. When it is ready, you can now withdraw the drug from the vial. Then what you do, you get the syringe, you remove the cap of the needle. Then first make sure you put equal amount of air into the vial before you start withdrawing the drug from the vial. You put equal amount of 4.7 millis of air. You inject into the vial. So make sure you put equal amount of air into the vial. Then what you do, you hold the vial horizontally so that you can withdraw the drug from the vial. Make sure you keep the needle in line with the liquid to avoid air bubble rushing into the syringe, so that you can withdraw all the drug. So when you finish, you remove the needle from the vial. Then you remove any air bubble. Then you put back the cap of the needle to avoid contamination or injury. Then you place it on the working bench. Then now you can administer the drug safely to the patient. So make sure you follow the advice of drug administration. That is right patient, right drug, right dose, right route, right time, right reason, and the right documentation. Once you finish diluting, ensure you administer immediately the drug to the patient. What about the one of 1 gram powder for injection? In the 1 gram powder for injection, you can dilute or reconstitute with 5 millis of sterile water for injection. So this is how you are going to perform. Make sure you get the syringe together with 21 gauge needle. You remove the syringe from the manufacturer's packaging. Then you get the needle and you remove it from the manufacturer's packaging. You get it. Then what you do, you open the plastic vial to withdraw the sterile water for injection. You remove the cap of the needle. Then you withdraw the sterile water for injection. So now we are preparing the 1 gram powder for injection. So we have to withdraw 5 millis of sterile water for injection. So you withdraw 5 millis of sterile water for injection. Then what you do when you finish, make sure you remove the air bubble. Then what you do, you put back the cap of the needle. Then what you do, you open, you flip over the opening of the vial. Then you get an alcohol swabs. Then what you do, you clean the opening of the vial with an alcohol swabs. Then what you do, you get the syringe, you remove the cap of the needle. Then you inject the sterile water for injection into the vial containing the white border of ampicillin injection. When you finish, you remove the syringe, you put back the cap of the needle, then you start shaking the vial gently like this until all the drug is completely dissolved. So this is how you are going to shake the vial gently so that the drug can be completely dissolved. Then when you finish diluting, then now you are supposed to withdraw the drug from the vial. So make sure we have diluted with 5 minutes of sterile water for injection. Then we have to put equal amount of air into the vial. So we have to put equal amount of air, that is 5 ml, into the vial so that we can withdraw the drug easily from the vial. You have to put equal amount of air. You have to put equal amount of air into the vial. Then you hold the vial in a horizontal manner so that you can withdraw the drug easily from the vial. Then what you do, you have to keep the needle in line with the drug to avoid air bubble rushing into the syringe. So withdraw all the drug from the vial. Then when you finish, make sure first you remove air bubble from the syringe. Ensure that you remove any air bubble. Then what you do, you put back the cap of the needle. Then once you have finished the diluting, then you can administer the drug safely to the patient. Make sure you follow the 8 types of drug administration. That is right patient, right drug, right dose, right route, right time, right reason, and the right documentation. Ensure that you check the patient's chart and you follow the recommended dose from the physician or from the prescription of the doctor. So that is how you are going to prepare and administer ampicillin for injection. So please, if you find the video helpful, kindly subscribe, like and share, and give your comment to this video. Thanks for your watching and have a nice day.